Unified Journey of Healing the Mind, Body, and Spirit would like to welcome you back this week. We're going to be discussing the holistic benefits of massage with Meghan Trujillo. Trujillo, I'm so sorry. I knew I was going to make that mistake. Anyways, Meghan is an expert in massage, and she practices right here in Bullhead City. So what do you have for us today?
Well, I just wanted to talk a little bit today about exactly what massage therapy is. Some simple, basic benefits that you can get from it, and some that a lot of people don't really think about. Also, I really want to touch on sports massage and how athletes can really benefit from it, and really just how massage therapy is for everybody.
Wonderful.
So the first thing about massage therapy is just a basic kind of textbook definition for it is that it therapeutically manipulates the muscle and soft tissue in the body to help relieve pain, as well as to help gain back your basic function, maybe after an injury or after post-surgery, and helps with swelling and things like that.
Oh, yeah, okay.
So a lot of basic benefits that a lot of people don't think about when it comes to massage therapy is that it's great for your circulation. And a lot of people think that you don't really have bad circulation or really come upon that problem until maybe you're a little bit older. But people of all ages can have bad circulation or can have trouble with their circulation, and that's blood flow, how the blood flows throughout the body. And
well, a simple sprain or something like that can cause that problem, can it?
Exactly. So many things. Or also like edema, just swelling throughout the body and things like that. And that's vital when it comes to our rehabilitation and our healing, whether it's healing from a basic cold or it's healing from an injury or a broken bone or surgery.
So you can help with like colds and stuff, like sinus problems?
Oh, absolutely. You don't necessarily want to go get yourself a massage if you have a fever or you're incredibly ill or anything, but massage therapy does aid a lot when it comes to your immune system. And it also helps reduce stress and helps with depression and anxiety. And those things actually all work hand in hand. And so a lot of people don't realize is that if your job is really stressful, or maybe you just have a lot going on, and everyone has daily stresses in their day-to-day life, that takes a big impact on your immune system. And it helps us to not be able to sleep at night, which is when we do pretty much all of our healing. And so massage therapy boosts your immune system, which can help reduce that stress, which can help you to better function throughout the day.
Well, that was interesting. More than I realized. I just thought it felt good.
That's what a lot of people think, and don't get me wrong, it does feel amazing. And a lot of people go maybe once a month, a couple times a year even, and they go and they get their tension relief massage, and that's wonderful. However, massage does so much more than just make you, feel better for the day or even, the week. It's something that can really aid in your health in so many different ways.
Well, that's good to know. It's good to know. Is it really sensitive?
Honestly, it depends on where you go. Personally speaking, I have always worked through chiropractors. I love chiropractic care. I've been seeing chiropractors myself my entire life. So it's definitely something I believe in, and massage therapy and chiropractic care both work hand in hand.
I agree with you. I see how they could work hand in hand really well.
Definitely. Everything in the body is connected. You really can't, manipulate one thing without it affecting another.
Right.
And so to answer your question, is it expensive? It can be at times depending on where you go, but sometimes you can find help through insurance depending on if you go through a doctor, or sometimes you can find preventative care insurance.
Well, is there different times, like for instance, do you take clients that are for 15 minutes or a half hour or whatever it is?
Sure.
And then an hour?
Sure. Most of the time for an hour massage, I'll charge $65.
Well, that's pretty fair.
For a 90-minute, I'll charge $90. And with the $90 for the 90-minute, typically it's $1 a minute. And so if somebody comes in and they say, oh man, I really need my neck work done, I didn't sleep right, can you just give me 10, 15, 20 minutes? Absolutely. And I'll just charge you $1 a minute, and do
well, that's simple to know what to expect when you go in. So that's good.
Definitely.
Thank you for sharing that.
Absolutely. And it's so often that we find ourselves that we didn't sleep right, or maybe we our job is taking a strain on us and we're not realizing it.
Mhm.
For an example, when I was working for a chiropractor in California, when I first started doing massage, didn't have many clients, and we had a man come in that had just Googled us. And he didn't speak very much English at all, and he came in and his arm was just stuck in the air. He said he just woke up and his right arm, his dominant side, was just stuck in the air. He couldn't move it. He was just saying, help, help, help. Don't know what to do. And so the chiropractor, of course, she knew exactly what to do. He got adjustments and massages as well. And after 3 days, he was without any medication or, any painkillers, muscle relaxers, anything of the sort, with chiropractic and massage therapy. He was able to have function back and write his name. To whereas when he first came in and saw us, he couldn't fill out any paperwork. He couldn't even open a door. So it was then that it really opened my eyes to how that can really help people in their everyday life.
Well, and I'm sure after the first visit, he was feeling a lot better.
Oh, yes. He definitely had hope after the first visit, because that can be scary, when you wake up in the morning or, get off of work or maybe tweak your back or make a certain movement and then, oh, no, something's not moving right.
Right.
That's a very scary feeling. And and that is what massage therapists, most of the time, if you're able to find them in your community, sometimes it can take weeks or months to get in to see a doctor or a specialist, things of that nature. Most of the time, massage therapists, give them a call. You can get right in and they can start working on that.
Oh, that's good. That's good. So you don't have a long wait list?
Not typically. I do prefer people to schedule out their appointments because that also shows me and the chiropractor, if they're working with them as well, that they're taking their preventative health care seriously. And so it's always, I do recommend planning out your preventative health care, your massage.
Say I wanted to make an appointment with you. I woke up this morning and my neck was out. So if I called your office, how long would it take me to get in to see you?
Well, if your neck is out and you're not able to have any range of motion, you can't move from side to side, up and down, we would try to get in and see you that same day right away. Absolutely. I have people call me all the time and they say, Megan, I'm sorry to do this to you, but I can't bend down. Or I can't move, I can't get up. And I say, I'll meet you there, as soon as possible. And unfortunately, if it doesn't work out, it doesn't work out. But that's definitely our goal. I never want to hear of a client or of anybody, not being able to get up at night.
Right.
And get up and use the restroom, or not able to get up and check on their kids, or if somebody else in their home needs them. So I definitely try to get to everybody right away.
Oh, that's good. That's really good to know. I have another question, and it just left me.
Well,
there's so many questions. That's the problem.
Right.
It's where to pick the right questions that everybody is interested in. And underneath this video, there will be a place. If you have questions, please put in your questions, and we'll get a hold of Megan and see if we can't find the answer for you. So if I haven't asked the question you want to hear, then please put it down. Okay, so you were talking about preventative medicine.
Yes, preventative health care. So that's something like we were talking about earlier, the whole holistic care in general as well. Preventative care is also something that's rather new. Not a lot of people are really aware about it. They think of a massage and they think that it's a luxury.
Right.
They think it's something, I'm going to go to the spa, I'm going to get a salt wrap and some rocks rubbed on me and it's going to be great. And yes, of course, that is wonderful.
Right.
However, it also does a lot in preventative healthcare.
We have a problem. It said share screen. It came up there.
I think it's okay now. I'll cut that part out.
Okay.
It says it's still recording, so.
Okay. Sorry.
Oh, no, you're fine. But preventative healthcare is just really important because, and the way that I try to kind of explain it is, think about that insurance maybe for that cell phone or that plane ticket or something that you think, oh, I'll make the flight. I won't miss it. I'm overly punctual,
Right.
And then something happens, there's traffic, there's an accident or something, or you misplaced your passport or anything could go wrong and you didn't have that insurance. And preventative care is kind of like that insurance that you're not really sure if you're going to need. But it's always smart to get it just because I personally even have heard, testimonies from people that have gotten massaged once a week for their entire lives that say, oh, I've saved so much time and money and, from getting my massages, from boosting my immunity, from improving my circulation,
Right.
from, paying attention to any swelling or any edema that, comes up out of nowhere and taking care of that right away or doing everything I can to prevent it. And you save so much, you end up not having to use that health insurance with the super high premium and,
Right.
not getting, all those prescriptions and, with all the side effects that they don't tell you about in the small print.
Right.
So you really end up saving a lot more than you're spending when it comes to spending money on the massage.
Right.
And but it's hard to see that because out of sight, out of mind.
Right.
If it's not right in front of you, you don't really think about it.
Mhm.
But so often have I heard people that are just so thankful that they came upon holistic care in general as preventative care and how it helps them.
A lot of people don't even know what holistic means. And so just for those people that are listening who don't know, holistic is everything, the whole body, mind, and spirit, all being treated at the same time. That's what it means. And so when you're talking about chiropractic and massage, we don't want to forget or eliminate some of the others like acupuncture and meditation and yoga and a lot of the other things that all come into that, along with your religious worship services. We don't want to eliminate that either, because that's just as important as the rest. You need to be spiritually in tune with your higher power. And so I'm glad you brought that up. Thank you. And then you said that you also work on sports injuries.
Yes, I love working with athletes. I grew up an athlete myself, and while I was in massage therapy school, one thing that I remember feeling was, wow, I wish I had this when I was an athlete. I have scoliosis or have scoliosis myself. And so as a weightlifter and a basketball player and a runner, I compressed and elongated, and I ended up out of commission quite a bit when I was a kid. And I remember, and I had the chiropractic care, but I knew nothing about massage. Didn't even consider it an option. Again, I thought it was something you just went to a spa for. And so as I, still begin to learn more and more.
Sometimes we've heard like strange stories about massage.
Oh yes.
Too, and that's.
It leaves you skeptical.
It really does.
It does, and that's yeah.
And it brings me to another question. When someone comes in, do you have them disrobe? Do they wear their clothes?
I'll be completely honest. I was trained to hospital drape, so it doesn't matter if you have everything on, everything off. I still drape the same. You will always be covered, but I will be honest. I prefer everyone to just take everything off. It makes it much easier. If you're comfortable with it, it causes you to be more relaxed as well.
Right.
And it makes it easier for me to, get into that soft tissue and break through to the muscle.
Well, you use oils, don't you?
Of course, yeah.
And so it's kind of hard to use oils through the clothes.
Yes, definitely.
So,
But then again, not everybody likes oil. I've definitely had a client here and there that have come in and maybe their skin breaks out. They have really sensitive skin, or they have to be somewhere and don't have time to go take a shower. And
so you basically leave it up to the client if they're comfortable or not comfortable.
Of course, yeah. I have things that I prefer, but it's not about me. It's about the client.
Well, I've had massage over the years many, many times, and for me, I would rather disrobe.
Oh yeah.
And just let them put the oils on and do their thing.
Absolutely.
Yes, it feels so good.
And then, it really also depends too, whether you're working with, of course, children or working with elderly, because a lot of times patients that are a little bit older, or, maybe have, walk with a cane or have trouble, have hip replacements, knee replacements, they don't always, can't take everything off or, but then a lot of times with those clients as well, you're not necessarily doing the deep tissue, you're there to aid and to help make their life easier.
Right.
to help make them feel better day by day.
Do you work with arthritis?
Of course.
And how does that work with arthritis?
So with arthritis, what it's really about, again, is going to be circulation and blood flow, and that's why that's one of my most favorite things to talk about, because it's just so vital to everything. It's really vital to our healing. So when it comes to arthritis, what you're doing is you're just, an easy way that I always like to say it is you're showing the tissue some love.
Oh, that's a really nice way to look at it.
You're just showing some love. A lot of times I use what's called cross fiber friction, which is there to separate the muscle by fiber, and also, again, there to increase circulation, increase blood flow. And I'm not a doctor, so I unfortunately cannot heal your arthritis, but I can definitely make you feel better.
Oh, that's good.
Definitely.
I know that when I'm stressed about things, as we all do get that way from time to time, it's in my shoulders. They get just like rocks.
Yes.
And so massage really helps loosen that up. And it makes a big difference. I have headaches and stuff, and after I get a good massage, all of that subsides.
Oh, yes.
Helps you relax.
So much of it, and, we all like to wear shoulders as earrings, when we get stressed out. We all like to do this. And it's just, even myself, when I get a massage, I'm amazed at how much I'm carrying, how much energy and just static I have going on, because, right here, especially being so close to our crown and everything, we have a lot of energy flowing in this area. So that's the first place that most people carry their stress. And every now and then I find some that don't, which I always find very interesting and ask how they seem to do that. But that's the first place people always seem to carry their stress out.
Well, and how does that work with the chakras?
So, I like to incorporate like meridian work a lot, energy work. You definitely want to always flow towards the heart. That's something that I've always done. And again, everybody's different. So, I've had people come in and they have released their energy by laughing on my tape. They just burst into laughter. I have some people that burst into tears. And so whenever that happens, there are different pressure points, like on your face or on your head and your feet, that can relieve that pressure.
Do you mind talking about a little bit about those pressure points? Because I went to cosmetology school, so I know a lot about the head and the shoulders, but I don't know about any of the other pressure points that are good for relieving. Like if you have a headache, you want to rub back, at the base of your head.
Yes.
You got a couple pressure points back there, and they're easy to find if you have a headache.
Yes.
Because when you hit them, they're going to be real tender.
Oh yeah.
And so, and I love to give like scalp massages. I like to touch.
Oh.
I'm a touching person. And so I have a friend, and when we're together, like I do that a lot for him. I'll rub his head and he'll just like go to sleep.
Oh yeah.
Go sleep on me because it feels so good.
Oh yeah, definitely.
And I love it too. I love it when someone's playing with my hair.
Oh gosh,
oh my gosh, it's just
relaxing, and that's one thing. Is just touch in general is so soothing. And I remember being in school, which by the way, I went to Southern California Health Institute. They have an amazing program. I got really lucky. Actually, just picked them out of a hat practically. But they were fantastic school. And one thing that I remember learning there was actually a study done. Forgive me, I couldn't give you the specifics on it, but it was held at an orphanage, and they had, I think, 20 different toddlers, and half of them they would show love, and they would touch, and they would hug, and they would massage and play with their hair, and things of that nature. And then the other 10, they wouldn't touch, they would keep the bubble around them, I would say. And the 10 that had that bubble around them, they were more prone to illnesses. They maybe had ADD, ADHD, they just ended up not really being wired as healthy or the same.
Touch is really important.
Definitely.
It really is.
Definitely. And it's also how we as people connect. And that, I mean, it's so obvious because I'm connecting, but
Mhm.
it's, spiritually and emotionally and
Well, you
mentally.
do have good hands. That felt really good.
Well, thank you. I definitely enjoy it, that's for sure.
Yes, I agree. I agree with you. I really like it too. And I have seen the benefits of that touch
Mhm.
in people. I was raised in a family that we were all touchers. We were all huggers and
Mhm.
kissers, and people in our family and extended family and friends, when they would come by, we were all huggers. We
Oh,
just
yeah.
really touched a lot. And but that didn't sound too good. But I mean, we like to dance and we like to hug and we
Mhm.
like to show our affection.
Oh, yeah.
And so, and that really helps with everything. It helps you be happier.
Mhm.
It really stimulates a lot of different
It
things.
aids so much, and I come back to anxiety and stress and immunity a lot because they go hand in hand. And the reason I say this is because I suffer from some anxiety myself, and in my experience, I get stomach ulcers, and I know that that's a sign that I'm too stressed out. My immune system is low.
Right.
And that's why I have a stomach ulcer. And that stomach ulcer is causing my immune system to lower even more. And so those things just really go
That's
hand
time
in
for
hand.
or for meditation.
Yes, meditation as well.
Yeah.
Just really aids in that. And that's one of my favorite things to do as well, is do maybe like breathing exercises with my clients, either
Yes.
before or after, maybe if they've never gotten a massage before
Mhm.
and they're really nervous, I'm not sure what to expect, which I get a lot from like older men. Older married men, they're nervous, they've never gotten a massage, worried about being touched. And I say, hey, let's just breathe a little bit. Let's turn on this music, let's get grounded, let's relax. And it really helps out a lot. So much meditation.
So let's say I've never had a massage before, and I walk in to your office and I say, Megan, I would like to have a massage. So walk me through the steps. What would we do from there? Do you have a room that you go to?
Yes. Well, I am located at Polly's Chiropractic in Fort Mojave, and I am in their office, but I do have my own entrance, my own waiting room, and everything. So, but pretty much what happens is you call me up or you come into the office and you say, hey, I've never had a massage before, and someone recommended it. Let's get started. I would just basically ask, what do you do for a living? What brings you in? Why did this person recommend a massage to you? Just get to know you a little bit.
Right.
And because there also is that whole fact that everybody's different. Not one of us are the same.
That's so true.
And one thing as a massage therapist, and I've never met a massage therapist that doesn't think this way, which is really nice, is I might not be the one for you. I might not be your massage therapist, but I'll help you find one. Maybe I love what I do and I love helping people, but I don't want you to keep coming back if it's just not right. Let's find you someone else. Maybe if it's a different location, maybe you don't like my setting. Maybe, it could be anything.
So what is your setting like? Let's say we've gone through, the introductions and you're taking me back to your room. What does your room look like?
So you walk in and I'm really bad at size judgment, but I would say it's, oh gosh, probably 12 by 12 feet, the room. So it's a rather large room. And for a massage, got the table in the middle. I love to do my table up. So when I say that, I mean, I put a mattress cover on there. I put, an extra pad on there, and then I put the sheets, and then I've got a throw on top of it. I have, I want you to be really comfortable. I don't want you to want to get up. I want you to lay down and just say, oh, this was the right place to be.
Right.
And then I also have diffusers. I use my essential oils. And a lot of the time, unless I know what that client prefers, whether it's eucalyptus, sweet orange, chamomile, a lot of times I'll put on however I'm feeling, and I love eucalyptus and peppermint. They're very cooling, and it makes me feel very clean and very fresh and just very, I guess, those mornings when you wake up in the morning and you're just ready to go. It makes me feel like that. Yes. And so I get my diffuser going. And then as far as the music goes, I always ask. Most people don't have much of a preference, but I normally pick some sort of Reiki music sometimes, or I love wind instruments. and
I do
the
too.
piano.
Wooden flute. I love wooden flute.
Yes, and one that I got into not long ago was actually shamanic music from like shamans.
Oh, yes.
Yes, which was, and they use a lot of wood instruments
I
as
have
well,
some of that too.
which is really, really neat. And rarely will you find me using ocean sounds because sometimes people have to get up and go to the restroom when that happens. So yeah, so we try to refrain from that. But I mean, I've also had people come in and they say, you know, can I listen to AC/DC? I say, absolutely, I love AC/DC. You know, or somebody that says, I really have this podcast I want to watch. And I was like, oh, put it on the floor on your phone, you know, because again, it's all about the client.
Right.
You know, I try to listen to motivational videos as much as I can throughout the week.
Right.
So I get it. If there's something that you need to listen to, you want to watch something that makes you feel better, then I have no preference. You know, by all means, let's use it.
Okay, that's good.
So yeah, it's really more about the client than anything else.
Well, it sounds very similar. I do Reiki energy healing. And so when I set up a room, I like to have it like that as well, kind of like you're describing. I like the lights down low and everything very clean and soft, and the candles going, incense.
Oh, yes. Yeah. Oh, yes. That's a must. Absolutely. Yeah. Try to sage as much as I can as well.
Right.
Sage is amazing. And, but yeah, you know, just try to keep the atmosphere and the ambiance just really zen, you know, just keep it really comfortable. Just, you know, that's the one thing I love about massage too, is that before I did this, I was in restaurants for about 10 years, and going from that to massage, it's just the most relaxing career you could choose. You know, I never have a bad day at work. And so that is not only great for my clients, but it's great for me too, and great for my home life and things like that. So
well, and you work in a holistic environment anyways. Everyone around you is doing kind of the same type of thing as far as being involved with holistic medicine. And so that, I'm sure, would definitely improve your work environment.
It's a great atmosphere. And that too at Polly's Chiropractic, they're a wonderful group of women. That's the thing that I really love about it too, is that it's, you know, women doctors and, you know, women massage therapists and physical therapists, and you know, we're all getting together and making a difference and making people feel better. And it's just, I couldn't ask to be a part of a better group.
Well, that's great. We want to also put on the screen here some contact information for you so people can give you a call. Let me see if I can do that. We're missing the slides.
So,
That's right.
there we go.
Oh, no, that's not
Sorry,
one for that.
Yeah.
Okay, there you go. On the screen, you'll see her phone number there. I hope it's not being hid by our screen. Yeah, there you go. Okay, I'll try it again. Okay, you'll notice that Meghan's phone number is on the screen. So make sure you jot that down and give her a call. Even if it's just to try it for one time.
Oh, yes.
Come in and try it just once and see if it's something that you're going to want to come back for over and over again. I can't imagine you not wanting to do that. What else we have to talk about today? What else can you share with us?
Well, I think we started to talk about sports massage.
Oh, we sure did.
And we kind of got sidetracked.
I'm sorry, that's my fault.
There's so much to talk about. I love working with athletes, again, because I was an athlete. And I didn't realize how beneficial it is. And it's something that I wish I would have had, you know, when I was younger. And so you have pre-event massage and you have post-event. And the pre-event basically is something that is a massage that is meant to complement your warm-up. So, anytime that you're going to go, any athlete or anybody that's going to work out even, or, now like CrossFit is just a huge thing. I have several people that do CrossFit.
What's CrossFit?
CrossFit, it's you use weights and it's like circuit training kind of. I think where you go from like one workout to the next.
Oh.
And so it's really, and there's people do competitions and stuff. So maybe you'll do like however many pull-ups, and then you'll do push-ups, and then you'll do something with weights, and then you'll run, and then jump ropes. Or I've never done it myself, but I know several people that do, and it can be really, really strenuous. So something like that, a pre-event massage would basically keep your muscles warm, so you don't strain anything, you don't pull that hamstring. And so it just complements your warm-up, your stretches that you're already doing, hopefully.
So if somebody, like, there's a lot of people in town that go to the athletic club. So going there and working out and then coming and seeing you maybe afterwards?
Well, there's also post-event.
You said
which
that,
is
yeah.
the next thing. So post-event, basically what that does is it helps lower your recovery time.
Okay.
So, and it helps eliminate that lactic acid that a lot of people get. It keeps you from being sore. So a lot of athletes will tell you if they're really sore, I just need to get out there and run. I need to run it out. I need to work it out. Well, a massage therapist can work it out for you. Can help you work that lactic acid out, can help stretch you out, and just help that recovery time from your event get you ready for the next one.
Oh, okay. Do you work with a lot of high school students?
I have not yet. That's something that I have actually spoken to a couple of people about. Maybe, but not with schools or anything. I've just had a couple of parents call me. It's something I would definitely love to do. I think it's really needed, coming from that background myself. And I have a brother that played football in college and ended up having to have both of his meniscus removed in his knee. And, which is, he's okay now because he's still young, but in a few years, he's really going to be feeling that. And I strongly believe that, those kind of things, and ACL tears, or, losing cartilage in your hips, or, a lot of things that young athletes come across, and tears and sprains and things like that can really be prevented with massage therapy.
Well, don't the professional athletic teams, don't they have personal massage therapists that work for them personally?
Yes, and I only know that because I actually have someone that I went to high school with that I think he plays for the Colts now, and our mothers are friends, and so and that's the only reason that I do know that most teams, they do have a team of trainers, and it's going to include like a massage therapist, physical therapist, sometimes even a chiropractor, and so they are there for the athletes as well. That would be amazing. That'd be a really cool job.
Right. Oh, I'm sure it would.
Yeah.
It'd be very interesting.
Oh, yeah, it definitely.
But I would think a massage therapist would work alongside the physical therapist, wouldn't they?
They do sometimes,
Or
and
do they overlap?
don't. Sometimes, there's a lot of things that a massage therapist does that a physical therapist does as well. Something like TMJ. TMJ is something that both a massage therapist and a physical therapist and a chiropractor can all treat. So it really.
So what is TMJ? For those people that don't know.
TMJ is something mandibular joint. It's that it's like lockjaw. Basically, when you hear that clicking, or people that grind their teeth at night, and that's when you wake up with those headaches all right here, and sometimes people get their jaw stuck open, and it's all about working the muscles, and sometimes even getting inside the mouth and in the jaw in there, and a physical therapist can do it. So sometimes you'll see physical therapists and massage therapists kind of competing, for business and things like that. But again, like I said, most massage therapists, at the end of the day, we just want you to get care. We just want, and it's all about the client and finding the best way for you to get care. So,
that's good.
Definitely.
Yes. I can see where the high school students here that are on the football team and basketball team could really benefit.
Yeah.
And we have male and female teams that can benefit from that.
Definitely. My son, my 8-year-old plays football, and I work on him.
At
all the
8
time.
years old, really?
Oh, absolutely. I stretch him
God.
out, and he's so funny. He'll be outside playing or something, and he'll scrape his arm, you know, and he'll come inside and he'll turn around and he'll say, "Mom, work your magic." And I'm like, "Well, you need Neosporin." Like, you
Oh,
know?
that's cute.
So he knows mom helps, you
Mhm.
know, and so, but yeah, I mean, I stretch him out, you know, make sure he's iced, you know, everything like that. And that's another thing too, you know, because I know getting massage therapy like in schools is something that would be a little difficult because, you know, parents don't want their kids to be touched,
Right.
you know, and I get that, I understand that.
Sure.
But I think
No, but the parents
information,
bring them to you.
that as well, but I
Mhm.
think just being informative with
Right.
parents, you know, maybe getting those athletes parents together and just say, "Hey, this is what's going on in your kid's body right now because they're going through puberty,
Right.
you know, excuse me, they're going through growth spurts, they're, you know, so much is going on, you know, during those ages, and with them playing a sport or multiple
Right.
sports, here's what it's doing to them, you know, whether it's stunting growth, whether it's, you know, causing scoliosis or losing cartilage, you know, other
Right.
things that we spoke of, and just informing parents. Because if they're anything like my mom and dad who were, you know, go out and play everything you can,
Right.
they unfortunately, it's not their fault, but weren't aware of, you know, what my body was going through. And although I was having a lot of fun,
Right.
I was hurting myself at the same time. And by the time I was 17, 18 years old, I definitely could feel it.
Right.
So I think just making sure that information is out there and available, if anything, would make a huge
Well, that's good. Good to know.
difference.
So what else we have here?
Oh, so I basically just wanted to get it out there and make sure that everybody knows that massage therapy is for everybody. That, you know, you might feel great, you might have a great, easy job, you might, you know, your kids might be angels that never give you trouble, and,
Right.
you know, that cup of joe might just do exactly what it's got to do for you every morning, and you don't feel like you need much else. But again, preventative care is something that, you know, just you really can't talk enough about because you're not sure what's going on 2 years
Right.
down the road, 5 years down the road, 10 years down the road. You
Mhm.
don't know even what other stressors are going to come into your life and inhibit you,
Mhm.
you know, inhibit your stress levels and your immunity. And, you know, God forbid, cause you to have surgery later on, or,
Right.
you know, anything of that nature. And that's really what we want to try to prevent is, you know, the overuses of medication and surgery as well.
Well, anytime we can avoid putting any chemicals into our body, it's always a plus.
Definitely.
And I've known people that have, as we age, and you had brought that up earlier, as we age, we start to get stiff and things aren't moving quite as good as they used to. And I have a really good friend, and for a while there, he could barely move. And so he went and he got acupuncture and he got chiropractic treatments, and he really started actively searching out for those alternative methods rather than taking pain pills, which he didn't want to do. And now he moves really well. I mean, he's still getting older and he's still having a little bit of difficulty, but for the most part, he's getting up and he's moving and he's doing stuff that he felt he couldn't do before.
Definitely.
And I agree, and I've done the same thing. I had a bad fall several years ago, and I mean, it was one of those falls that I knew when I went down, I was hurt.
Right.
And then, we had been moving, my husband and I had been moving, and we were sleeping on our mattresses on the floor. So he woke me up and he says, "I'm going to go get one more load and I'll be home." And I said, "Okay, that's fine." And so after he left, I had to get up and go to the restroom, and I couldn't get up. So I literally said, "I fell and I can't get up," because I couldn't get up. And at that time, there weren't cell phones out there or anything. So I had to crawl over to pull the phone down off the table, and then called him and said, "You got to come back over here because I can't move." And I was petrified. The only thing I could think of was, I've got to call an ambulance. They're going to come out. They're going to catheterize me. And I was like, oh no, it's so scary. Yeah. And so he came right back, gave me some ibuprofen. We got up. I went to a massage therapist, and she helped me, helped all that stuff start to calm down. And then I started getting chiropractic treatment and massage at the same time. And I did that for several years. And even now, it's been probably 30 years since that happened or plus. And once in a while, if I'm not careful, that spot in my back will
Oh yeah,
flare up.
it definitely.
And then I'm finding myself, oh no, I can't get it. I can't move very well, and I got to take it easy.
Mhm.
And so massage therapy does help with that a lot. And so does chiropractic.
Oh yeah, and what's so great about it, and the reason why now, 30 years later, you still feel it every now and then, but typically your body sees what's happening, gives you the signal of what's going on, and you know what to do because of what worked in the past. To whereas if you had gone and taken muscle relaxers and maybe a painkiller, it's just turning that signal in your brain off.
Right.
To what's going on.
It's not stopping the pain.
Right, and leaving it open for it to just get worse and get
It's
worse.
just
and get
fooling your
worse.
mind to thinking it's not there.
And then next thing you know, 30 years later, instead of being able to sit here and upright and walk around today, you maybe have a cane or a walker or
Right.
it had to have surgery.
Right.
So it's just, again, preventative care.
And I work with people that are elderly and have disabilities. And I see a lot of, like I have clients that are in their 80s, they're up and they're moving around and they're dancing and they're like, I mean, I have one client and she's so sweet, 85 years old. Her and I dance around in the living room and she gets around really great. And then I have clients that are bedridden because they can't get up.
Absolutely.
And I think it's kind of not knowing about these other treatments and what's available to them.
Definitely. Oh, so much of it is just not having the information.
Right.
Or unfortunately, a lot of the times, medical doctors don't want you to have that information, or may tell you to be careful with that information, and so it makes people a little skeptical about coming and having people put their own hands on them instead of taking a pill.
Right. And for years and years, chiropractic treatment, massage, acupuncture, all of those things were voodoo.
Right.
They don't really work. They're voodoo because the Western medicine didn't want you to go do those things. But guess what? We've been doing them since the dawn of time.
Absolutely. Yes.
And they were successful.
Yes.
Long before Western medicine came up with their pills.
Oh, yes. Yeah, massage was a big thing back in Rome when they had baths.
Right.
Like so many people would get massages. That was a form. Doctors would do massage.
Right.
Then, before modern medicine and everything, of course. But it's been around for so long, and it's just because it's something that works.
It is something that works. And we do it, like parents do it. And I bring that up, especially when I talk about healing energy. We do it all the time. We just don't know we're doing it for our babies. When our babies have a tummy ache, we're doing energy healing. We're rubbing that tummy and we're giving them massage and we're cuddling and holding them and feeling that energy, which you pass energy on when you're doing massage therapy too.
Absolutely.
And so it's very beneficial and helpful. And we've been doing it and we didn't even know we were doing it.
Absolutely.
So if you know that was beneficial when you were growing up, when your mommy was holding you and giving, rubbing your back and my mom used to hold my hand and rub my hand. Right? And it felt so good. Then why would it not feel good as an adult?
Exactly. Because we create this stigma
about
it. We build this wall.
And that's not even knowing what we're doing.
Exactly.
That's not even knowing. So if we go to someone like yourself who has the education and experience to really work on those muscles and joints and places that are painful for us, how much better we can feel.
Oh, yes.
It's amazing.
Definitely.
It's like a miracle.
Yeah. Well, it's one of my favorite things, is somebody that comes in and just sometimes how shocked they can be, when they're on the table or when they get up and go to leave. Just how it's just the look on their face is just they couldn't believe it.
Right.
Wow, how'd you do that? How'd you find
I can't
that?
believe I can move now.
And so much of it too is I'll have people lay down and they'll say, it just hurts, find it. And that's when I will, kind of react more off energy and stuff too.
Sometimes where the pain isn't actually where the problem is.
Yeah. Or you're not sure where it's coming from, or it could be sleep, or just could be a myriad of different things.
Right.
But so often people they just hurt. They ache, they're stressed,
Mhm.
and so much of it is diet, nutrition, and things like that as well, which is a whole other story. But massage definitely is a way to reduce that stress.
I can't tell you how many times I woke up in the morning and got out of bed and thought, okay, I could just walk this off. I just got to walk this off and I'll be fine.
Mm-hmm.
But if I was getting regular treatments, I wouldn't have to worry about walking it off in the morning. It wouldn't be there.
Right.
And so, yeah, we all need to remember that and not be afraid to go in and try.
No, and it's not something that, I've got to get a massage every single week to feel good. No.
No, but it would help.
It would help. Oh my goodness. But there's some people that and saying this is massage, that isn't it.
Mhm.
You do have a treatment plan, and you have, if you have some sort of injury or some sort of ailment or anything, we are on a plan, to
Right.
get you back feeling normal
Mhm.
and upright and everything. But if you want to maintain your health and again prevent
Right.
further things from happening, you can come twice a month, once a month. I have people that come every other month and get a 90-minute and they feel great after that,
Right.
But then it's also because they're going home and they're exercising, and they're eating right, and
They're doing what
drinking
they have to
water.
at home.
Yes,
Right.
of course, which
Right.
also plays a big role.
Right.
You got to drink your water, you got to eat your fruits, you got to eat your vegetables, you got to watch your sugar,
Right.
and which is hard to do. Nobody wants
Well, it's
to
the
do
thing.
that.
Okay, so let's go back to Western medicine for a moment. If you go into a doctor and the doctor gives you a pill, and you go home and you don't take the pill and you don't do the exercises he tells you to do, you're not going to get better.
Exactly.
It's the same type of thing. You go to a massage therapist or a chiropractor or acupuncture or whatever, and you get your treatments in, and then they give you something to do at home.
Yeah.
And if you don't do it,
then if you're going to fall backwards or
yeah.
just not go as far as you'd like.
A comparison would be like when we're in school and we're learning how to read and write and do arithmetic. We had to do homework. We had to do it over and over and over and over again until we got it right.
Definitely.
But once we got it right, then you don't have to practice anymore.
Of course. Because that's the thing too. It's a great point to bring up that if you've never been massaged before, and let's say you are just tense, you're like a rock, you really need some work done, you've got stress. Whenever we go and put our hands on you and start to do that work, your body doesn't want us to do that work. Your body wants to do exactly what it's been doing and be tense. And it's just like if you get a chiropractic adjustment, when they do those first adjustments, your body doesn't want to stay. It wants to go right back to how it was before. Mm-hmm. So that's why a lot of times at first, I have so many people sometimes that call me and they say, Megan, I was just so sore. Why am I so sore? I don't want to be sore. This is supposed to help me feel better. And I say, the soreness is good. If you're not sore after getting your first massage ever, I did not do my job. Because I am basically telling your body, I'm here to fix things. I'm moving stuff around, and your body doesn't want me to do that. It's yelling at you to yell at me to stop.
Right.
And so when you're first getting into that care, whether it's chiropractic or massage, you really do want to keep that in mind, because you might not always feel that complete relief.
But we're not going to say
away.
that they're always going to be pain relief. We don't want them to say
no, of course not. But then I have those people that come in that say, yes,
I want it to
hurt me, and
right.
But it's also because they have been doing it for a while. They understand,
right?
But then you have those people that come in. Like I saw one client for a little while. She had melanoma for about 10 years, and just kept beating it, kept coming back, and she's still with us today, thankfully. And she would get a massage every other week. She'd get a 2-hour massage, and it was just very light, very relaxing. I would maybe pump her lymphatic system a little bit, pump that old blood out, get that new blood in, and it was just very light, like light and breezy. Right. And she swore by it. She loved it. She didn't need that extra deep, and her body couldn't take real deep tissue either, due to her being ill.
Yeah, I really like it soft, but I've had deep tissue massage before, But I do like that. I like the calming effect and the relaxation
yeah.
and all of that, along with I just the touch.
Oh yeah.
I don't, my husband's gone now, and so it's like I like that touch.
Yes. To
And
feel. Yeah.
just to have somebody to come in and just touch my
It's
body
a human
and
contact in general. We're not people that are made to be
Right.
alone.
Right.
Completely alone. And so that contact and that touch, it means a lot.
a big difference. Yeah.
Definitely.
And excuse me, I'm so sorry. How are we doing? 20 seconds, so 5 minutes. Did you have anything else you wanted to talk about?
Oh gosh.
I'm running out of questions is my problem.
Yeah. Oh, pregnancy.
Oh, that's a good one.
Yes.
Okay.
So one thing that massage does is, of course, reduce pain in everybody. But one thing that is really, really great for is pregnancy. And so you don't ever want to get massaged during your first trimester. You always want to wait until your second, just because everything's still very fragile, during the first 12 weeks of pregnancy. So you always want to wait until
I wouldn't think that massage would affect that, though.
Well, believe it or not, there are certain areas of the body that you can massage that release the hormones of labor. So, like your hips and your ankles, for example, can actually, if you massage them on a pregnant woman at any point too much, you can actually send her into labor.
Oh,
just because it
really?
releases the hormone that opens up the hips.
Isn't that fascinating?
Right? It's really interesting. But massage is really great, though, because it helps a lot with, to help make labor more easy. On your back, so much goes on your tension goes on your back when you're pregnant.
So when a woman's, let's say when a woman's in labor, can she get massage to help her with the labor?
I've never known a massage therapist to do that sort of thing. I'm not. That's a really good question. I've never.
I would think that it would be helpful.
I can see where it would, but
Yeah.
I imagine myself in labor, and I don't know.
Like the lower back.
Yeah, I could see how it could probably aid a little bit.
Right.
But that's definitely something to look into. I've never
because
looked
we know
into
that the breathing
during labor.
Breathing is always relaxing. Whether you're in labor or not in labor, it's very relaxing.
It is.
So, but they're really teaching us now how to properly breathe while delivering. But I'm just thinking that the back and the upper and lower back would excuse me, help during those contractions.
Well, that's
to
what
minimize them.
Getting massage and chiropractic care as well during pregnancy really helps smooth labor along a lot, and it helps prevent you from having to get C-sections or again going into surgery. It's something that you want to prevent. Which some mothers choose C-sections, and that's completely fine. It's your own preference, but chiropractic care and massage would definitely aid a lot.
Well, there's so many things that are coming out that like have been around forever. We just didn't hear about it, didn't know about it. Then that's why we're doing these shows, is so that we can educate people on things that they haven't heard about before. And one of those is giving birth, like in a warm swimming pool.
Oh, yes.
It's supposed to help with the contractions a great deal. And so that's what made me think, if that would be helpful, what would it be like to have that massage on that lower back?
I feel like a doula would probably be a part of that, like a doula or a what do they call it?
I don't know. I'm still trying to figure out what a doula.
Oh, a doula is a doula is someone that you hire. I actually went to massage therapy school with a woman who was a doula and a massage therapist, and it's like a midwife.
Oh, okay.
Kind of, and but still kind of different, because you can have a midwife and a doula. But it's just someone that aids in your nutrition and your overall comfortability, and basically will hold your hand during pregnancy, and is someone that is on call and will be there, 24/7.
Right.
Middle of the night, anything. A lot of times they're there with you during delivery, even if it's in the hospital. And just like if you're having trouble going into labor, your doula will know how to holistically help boost you along,
okay.
whether it's like ginger or,
Right.
whatever kind of thing.
Lavender.
Whatever
Yeah.
kind they can put together and just to help make things easier. So,
Wow.
which is really, really interesting.
Yeah.
And they definitely help a lot.
Wow, that's really good. Now, do you help babies? Do you massage babies?
I have before.
How young do you go?
The youngest I have massaged is probably like
9 months?
probably. And the baby was just it was kind of colicky, and to be honest, I saw her twice, and so I like to think it helped. I unfortunately did not stay in contact because I ended up traveling. But I had to have the opportunity to work on 9 months, a couple of different times, and the baby loved it during what was happening.
Right.
Only for so long though. It was
Right.
about 10 or 15 minutes, and she was over it.
Right.
But you could definitely tell.
Well, that's pretty good for a baby, though.
Yes, definitely. Well, you could really tell where it was, because a colicky baby is a stressed out baby,
Right.
too. They're unhappy. They don't know why.
Uh-huh.
And so that baby is very tense, and with everything being so new and still forming
Right.
at that point as well too, you really don't want that in your baby, because
Right.
it's going to cause things that it's not going to cause the spine to maybe not form properly.
Right.
Or a lot of times that's how people when they say they're born with a dislocated hip,
Right.
a lot of times massage therapy can help, and chiropractic as well can help with that after the baby's born. So even a newborn, technically could be worked on when it comes to massage therapy.
Well, now I got another question for you. Excuse me. What about our pets?
Oh gosh, I know I've never done massage therapy on a pet. I know I love to love on my cat all the time, but that's pretty much it. I do know chiropractic care is awesome. I have seen horses get adjusted. I have seen dogs and cats get adjusted. As far as massage therapy goes, personally, I've never seen it or heard of it, but I don't see how it would.
I do like energy work on my pets, and I guess I do a kind of a massage with them to help them feel better, and I especially ride along the spine and the tail, like the tail end, rubbing those thighs.
Okay.
I do a lot of that with my pets.
Definitely, yeah.
They do benefit from energy healing.
Oh, of course.
And they also benefit from essential oils, which we'll be talking about next week. So check in on that. So yeah.
That's awesome.
Yes, I do too. They are the best. But anyway, so that's just something that I was wondering if you have never done that before, but would you be open to that?
Absolutely. Oh yeah, I would be open to that, as well as the labor, in labor thing as well, but because like I was telling you earlier, there are just so many benefits when it comes to massage that it's just, we could sit here all day long, and talk about it. There's just, a myriad of different things that it helps out. And again, I always go back to immunity, because that's just the most important, is our immune system. We don't have our immune system, it's hard to have a life. You can, but it's very difficult to. And
and that's what we want, is quality of life.
Quality, absolutely. That's a very good way to put it. Yeah.
Well, Meghan, thank you so much for coming and visiting with us, and I hope you
me.
come back and visit with us again.
Of course.
We would love to have you come back and talk to us about massage again. And on the screen, you're going to see our upcoming classes for the next month. And don't forget, we have guided meditation at Yoga Prana every Wednesday at noon. If you have any other questions or would like some information, call 928-296-1106.
Now they're seeing this.
Okay.
There we go.
Okay,
Okay.
that's good. Oh.